We're talking about movements related to low back herniated disc. I want you to keep in mind that years ago, everything that happened in the low back would be considered a disc problem. These days, we're likely discussing pain that's originating in the back with the possibility of what we call sciatic type pain, which is leg pain that's actually originating in the back. Typically with a herniated disc situation, we're going to be dealing with single-sided, so one-sided leg pain, potentially in the low back, into the hip area, potentially along the side or back of the thigh, in occasion wrapping around the front. So this is leg pain that originates in the back, potentially from a problem disc, although I will say there's a lot of problems in the back that really don't relate to the disc. Sometimes we give that a little bit too much prominence. The key here is that we're looking for ways to reduce leg pain. We likely have you applying ice for 15 minutes at a time to really reduce that inflammation, get your back working better. Once you're beyond that point, we might even begin working on some deep core work to help stabilize that low back. And once we've got things stabilized a little bit, we want to deal with some of that leg pain through a few movements that I'm going to show today. The first is called lower trunk rotation. With lower trunk rotation, we're going to have you moving with you on your back, your knees bent. You're going to be moving in what I call a zone of comfort. So you're going to find out what that movement is like and how far you can move before you push into pain. We want to keep that shy of pain for the time being. So we're going to do lower trunk rotation to start. With lower trunk rotation, I get on the mat, the bed, or couch, or on the ground with my knees bent, and everything kind of relaxed to begin. And I'm going to start moving with my knees and feet together. I'm going to move in one direction, and I want to find out kind of how much movement I have before I bring on any leg pain. I want to work within, as I mentioned, this zone of comfort. And it may be that you can only go part way in one direction, but that you can go further in the opposite direction. And I want to encourage movement. And so if you're moving in one direction and maybe it's a little sore, it's not the end of the world, but I'd prefer maybe that you actually start moving in the opposite direction so we can get greater movement, greater blood flow, more muscle relaxation. I like this exercise to be done slowly, almost at what I call breathing rate, so that you're just breathing through at a very relaxed and low intense movement. This can advance later on to more fluid and full movements in the low back, even into some various stretching. I'm not showing that today, only from the standpoint we want to start with lower trunk rotation done in a pain-free fashion for up to 5 to 10 minutes at a time. It's as if you're going out on a walk. You're getting blood flow, you're getting nutrition and lubrication into the joints. You're helping to actually bring healing into that disc. There's good evidence that rotational movement can help to heal that sore disc. So there's a lot of value and a lot of benefits to a movement like lower trunk rotation. Next, I want to talk about a position that can sometimes be used to take away leg pain. Again, we're talking about lumbar, potential herniated discs, sore discs that may be creating some leg pain, which is that leg pain that's originating from the area in your back. And so one that I found super helpful over the years is where you lie on a side, the sore side leg or the sore side is up. So I'm lying on my side, sore side leg, in this case my left leg is up, and I'm going to put my foot in behind my opposite leg. So my right leg here, I've got my foot in the crook of my knee, if you will, and my knee is quite forward on the sore side leg, my left leg. And then what I do is I comfortably roll back a little bit. I'd like to use maybe a pillow under my head, possibly a pillow under my knee. If this is too much and it's creating too much tension, you can put a pillow right under the top knee to take out that tension a little bit. But the goal is that I feel less pain in my leg. I might even feel that pain begin to travel up toward my back and into my low back. We call that centralization. It's moving toward the center, if you will, of your low back. that's a good thing. We prefer that pain is not worsening and going further down your leg. If it is, discontinue the position and talk to your physical therapist at your next appointment. The final group of exercises for problem discs in the low back originated with a physical therapist named Robin McKenzie out of Australia. And he kind of bucked the times where people were doing a lot of flexion-based movements. He actually introduced extension movements in the lumbar spine. And I know it's progressed in terms of how it's applied these days, but a pretty basic way to look at it is instead of flexing the spine, which is where we're bending the spine into either knees to chest, single knee to chest, that kind of thing, we're actually going to be extending the back where we see a little bit more of an arch in the back. So to begin with, what I like to do is have a person lie on his or her stomach and just feel, if I'm on my stomach, what is my leg pain doing? Am I feeling improvements in my leg pain simply by being on my stomach? If the leg pain seems to be improving to some extent, meaning it's moving closer to my low back, I may have people come up into, at that point, where they're on their elbows, maybe they're watching TV or just propped up on their elbows. If this position allows the pain to move from the leg toward the back, again, centralizing, the next phase would be to actually move into what we call a prone press-up. The prone press-up is where my hands are slightly forward. I like to start with my hands forward because when I do the press-up, I don't get as big a movement in my low back as if my hands were here. I would have a full arch in my back. So I'm going to start with a smaller one, hands forward, and I'm going to begin doing a real slow, progressive, easy press-up. And my goal here is to sense that the pain that's going down, let's say the side of my leg, begins to move toward my low back. And it may be that you actually end up with a little additional low back pain, but as long as the pain's coming out of the limb, in this case the lower limb, you're okay to continue with that slow, easy press up. So you're moving from where you're literally almost flat on the mat to where you've done a bit of a push-up, if you will, with your belly down. You're keeping your belly and back relaxed. And once you can do this for sets of 10, a couple sets of 10, break in between, you may eventually want to move your hands further and further back as you do the press up. That's going to give your back a little bit more of an arch. Now there's a lot of value with this type of exercise as I go through my prone press up. Yes, I'm working my triceps, but more so, I'm working on the hydraulics of the low back to get that disc, if you will, to move away from the painful ligaments, possibly even the nerves that are close by, and also to improve pain control so I can feel better, I can get less leg pain, and ultimately what I'm after is the physiological benefits that happen inside the sore disc. As I'm doing this on-off pressure with the press-up, there's a lot of research and evidence that indicates that there's a healing element that begins to happen within the disc to actually help to position the disc, but also to heal and strengthen the giant ligament that wraps around the disc, what we call the annulus of the disc. So that movement again, starting out with the hands forward, eventually moving those hands further and further back into a full press up where my belly and my back are relaxed. I can do this on-off pressure for sets of 10. And I like to hold a few, let's say I've done 7, I may begin to hold that for a count of say 4 or 5. And then I'll come in and do another one for another count of 4 to 5. And I might even relax in this position again, as long as that pain is coming out of my leg in this case and toward my low back. It can become a really comfortable exercise for you. And I usually work in sets of 10, maybe 2 sets to start with, and as you get more comfortable, you could move up into sets of 3 or 3 sets of 10. And remember to hold a few of those, like the 7, 8, 9, and 10, maybe hold those for just a little bit longer, keeping your belly and your back relaxed from extension.